add anything to the question. This is the overthinking study. But professor, this patient could develop a fat embolism. It's not yet developing any fat embolism. That's why it's not a priority. Just a fracture. Don't move the patient. Take the patient, immobilize the patient. Yes, and the patient need to wait. Okay. And the patient number 4, what you think could have? Flank. What is the flank? What is the flank? This side of the abdomen, no?
Kidney problems, what could be?
Is probably a kidney problem, probably a kidney stone. That is also an urgency. It's not an emergency. So the problem is we rule out these two very easily. Okay. Now, well, we have 1 and 3. What do you think is the priority?
3. Oh, sorry, 1.
3.
Okay, 3.
1.
Okay, what do you think has 3? What do you think has 3?
It's leaking a spinal fluid.
It's leaking cerebrospinal fluid. Why? Because probably has a head trauma because it's a vehicle crash and has a head trauma. And what part is fractured? No, nobody knows how you call it. Basilar skull fracture. The base of the skull. Basilar skull skull fracture. Basilar skull fracture is called that. Okay, you need. Yeah, yes, sir. Go ahead.
Yeah, for the 3, I think it's gonna be bleeding. If it's a fracture on the skull, I think it's gonna be bleeding. No,
Bleeding. Okay,
yellow
could
fluid.
be bleeding or not. In this case, they don't say is yellowish, so maybe has a little blood. I don't know, but it's a fluid that should not be draining. Okay, it's a clear fluid, yellowish, that should not be draining from the ear. And because those are polytraumatized clients, it's okay that we rule out, we have the responsibility of ruling out that this could be cerebrospinal fluid. And this happens when there is a basilar skull fracture, okay? When have you ever studied anatomy, the base of the skull? Okay, vamos a ver, but let's see. Okay, skull base, skull base. Okay, let's see, skull base anatomy. Let me see if I can find the base of the skull. Okay, so all those are skull bases. Okay, so notice how is the skull base, no? Is the part of the skull that is the floor where the brain is resting. Okay, brain is surrounded by meninges and cerebrospinal fluid and is resting in this skull floor. Okay, this part is formed by the occipital bone. This part by the temporal bones. This part are formed by the frontal bones, and the center by the ethmoid and the sphenoid bones. Okay, and notice that has a big hole for the spinal cord to live, and they have many, many, many little holes for the cranial nerves to leave. Those cranial nerves that you studied need to leave the skull, because that's why are called cranial nerves, because they originate inside the skull. And also we need holes for the artery, the carotid arteries to enter, and for the jugular veins to live. Make sense or not? Absolutely. So this is the base of the skull. Okay, in the posterior fossa, you have a structure that is the inner ear. The inner ear. So the inner ear and the middle ear in the area of the mastoids, okay, are part of the base of the skull. The base of the skull is the weakest part of the skull, and is the one that fractures with more frequency. When there is a fracture of the skull, as you said, there is tendency for the bone to bleed outward, to bleed, toward the face. If the fracture occurs in the anterior fossa, then is bleeding around the eyes, around the orbits, and produce the raccoon sign. That is this bruise, bilateral bruises in around the orbits. Yes. And when it is in the posterior fossa, then you can have this bruise behind the ear that is called the battle sign. But also because the meninges is there and there is cerebrospinal fluid under the meninges can be broken and the spinal fluid can leak through this fracture. If the fracture is in the anterior fossa, in the anterior part, the leak is through the nose. If it is in the posterior fossa, the leak is through the ear. The pressure of the leaking or the bleeding in the middle ear can perforate the ¿cómo se llama? The tympanic membrane, and then the liquid can come out. And then you can see a person leaking a liquid through the nose or leaking a liquid through the ear. Or you can see a person leaking a serosanguineous, I mean a mixture of blood and liquid through the nose, or you can see a mixture of blood and liquid through the ear. So this is, for the review, the scenario of a skull fracture. That is what is happening in this question. Yes, is somebody draining, somebody polytraumatized that is draining a fluid from the ear. Yes, so there is, we suspect that could be a leakage of cerebrospinal fluid. How we confirm that this is a cerebrospinal fluid liquid?
With the halo
with the
sign.
test. Yeah.
Okay, if the liquid is totally clear, there is no blood contaminating, we can do a glucose
A glucose test.
testing. If the liquid is clear like water, crystal rock, we can do an acute check the same way that with the same device that we do capillary blood sugar. If the liquid, this liquid has sugar, has glycemia, okay, has no glycemia, but the glucose, uh, this is cerebrospinal fluid. But if it is combined with blood, then we do the halo test. Okay, the halo test simply is to make a drop, okay, make a drop, may fall a drop, okay. Um, Let me see, I can find here a picture, halo test, okay, for spinal fluid. You can make a drop, let me see if a good one, okay, a a real one. I have in my PowerPoints a real one that is very good. This is more or less than those are good. Okay, so you are going to see that when you make a drop, okay, of 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 this mixture of liquid, okay, fall in a tissue, paper, a tissue, you see how the blood that is thicker separate from the cerebrospinal fluid. The cerebrospinal fluid is thinner, and by capillarity is going to migrate farther than the blood that is heavier, is thicker, and is going to separate, forming the cerebrospinal fluid that migrate more, a halo around the blood. Okay, this is what you see. This gentleman. This is what you see when there is crystal rock. Okay, leakage of liquid through the nose. Okay, because generally is all a fistula. Okay, so we have different situation. Okay, so now we have a patient with we suspect a skull fracture. Okay, what can happen to this patient? Okay, can be a patient with a skull fracture stable? Yes or not?
No.
Why not? Because as far as I know, the skull has not any function except to protect the brain. If the brain has not been included or affected by the fracture, the patient can be stable. Just with a patient can have an skull fracture without being critically ill. So what is more important, the bone around the brain or the brain? Critical thinking. I'm trying, I'm trying,
The
I'm
brain.
trying, I'm trying to build critical thinking, because remember this critical thinking what you need to pass the NCLEX. Yes. So tell me something. What is more important, the skull around the brain that is fractured, or what is inside the skull, which is the brain?
The brain.
Obviously, the
The
brain.
The
brain.
brain.
Is there anything in this statement that say that the brain has been harmed, has been damaged? No. Only there is a leakage of cerebrospinal fluid. Okay. So I have many pictures in my PowerPoint, a ver si puedo conseguirlo, that demonstrate that you can have, okay, let me see if it appears around. Ahí, el tipo que está parado en, okay, okay. So those are individuals with fractures of the skull, okay? I don't know if you are observing that the patients are awake. Are you noticing that or not? No. Yes or
Yes,
no, guys?
Professor.
React to me because I
Yes,
become
yes,
upset when
yes.
you start with the aloof attitude of MRU
Yes.
student. I become upset and I can't fighting with you. You know how the bad character that I have. Okay, okay.
Yes, perfect, sir.
Because the problem del Nclex is you, no me. I already passed my Nclex. Okay, okay. Muy bien. Entonces, I'm trying to build, okay, critical thinking. So those individuals have a skull fracture. Nevertheless, you see that are not critical. Why are not critical? Because are lucky. The brain was not included in the trauma. Yeah? The brain was a spare. Okay, the brain was a spare. Yeah. So it is important to have that in mind. And in this question, nothing because no, what I'm teaching you how to deal with the horrible nursing question that you will have in your test in your English. Yes. So now you have a patient with a skull fracture, but nothing else is said. Of course, it's very important to monitor this patient, hospitalize this patient, observe this patient, do a CT scan in this patient, and don't forget that if there is leak of cerebrospinal fluid, probably the doctor will start prophylactic antibiotics because remember, if the liquid can leave, also the bacteria can enter. Makes sense, no? Okay, this is the scenario of this client. Okay, so we discussed option 3. Let's go to the people that think option 1. Why do you think that a patient polytraumatized with a hematoma in the neck could be a priority?
Airway.
Okay, I
Airway.
like it. I like it. Okay, what we have in the neck. Okay, what we have in our necks. Okay,
The
okay.
trachea.
We have the trachea, which is airway, but don't forget that we have at each side, and it is a concern that the patient has hematoma. We have, conchale, me salió muy grande. You have two arteries that are very important. Yes, that are the carotid arteries that brings the blood to the brain, yes? And a trauma can produce a rupture, a laceration in the carotid arteries, yes? And what we have behind the trachea, which is very important, is very important behind the trachea. What we have behind the trachea?
Esophagus.
What is this? The
Stomach.
spine, the
Spinal
cervical
cord.
spine, guys. Don't forget how traumatic, how devastating is when the cervical spinal cord has been included in a trauma. You could have a patient with because has a hematoma, could have a fracture in one of the cervical vertebrae, and then you are at risk of having a displacement of one of these fractured vertebrae and having a severing or section of the cervical spinal cord, which is irreversible and can be very serious. So we have the airway, we have the carotids, we have many important structures here. And now they are saying that the patient has a hematoma in the neck. That suggests that it was a trauma in the neck. This hematoma is not described the size, but could be big enough as to compress the airway, or could be a consequence of a laceration of the carotid arteries that brings the blood at high pressure to the brain. And ¿qué más? And don't forget that you need to stabilize this neck because you need to rule out a spinal cord injury or cervical spine fracture. So now that we have a patient with just a lick of severe spinal fluid, don't add anything to the question. And a patient with a neck hematoma. Both are emergencies, but which one do you think need to be seen first? Obviously,
One.
the one. So this is the defense of why patient number one could be more acute and more at risk of a catastrophic consequence that the on patient with three, which is very serious, has probably a skull fracture, but there is nothing said there that is having a brain laceration or epidural hematoma or any kind of deep coma, et cetera, is not mentioned there, and we cannot add that to that. Okay, so it is the way of building critical thinking to being able to differentiate those clinical situations that you don't have any experience. That the problem you don't have experience, and then those questions require certain experience to have an idea how those patients behave and how those patients are managed. You understand? This is what make me surprised of how demanding is in America the level of knowledge required for a registered nurse, especially in the English. Let's see this question. A new mother is talking with a nurse about PKU. PKU is phenylketonuria, is a metabolic disease that appears at the moment of birth because is genetic, is hereditary, and produces accumulation of an amino acid that all we have, but we can break down when it's not needed anymore, which is the phenylalanine. Okay, this is not the question, usually the question, but you need to have an idea what is PKU. Okay, so this is PKU, and the nurse is talking with the mother is talking with a nurse about PKU and the PKU screening of her newborn. It's a routine. All the newborns are screened for PKU. Which of the following statements regarding PKU and PKU screening is made, if made by the new mother, is not correct? Okay, so it's a question negative, yes? So we are going to look for the wrong statement. So first, I need to understand the question. I need to take care of how I read. What is the problem of majority of us? We read too fast. I professor, I didn't read that. They say no correct. I thought it was correct. I'm so sorry, mija, but you have the question wrong because you need to read carefully, because when the doctor prescribed something, you need to read very carefully the prescription. You cannot read what you want. You need to read what is prescribed. Okay, so I professor, you are so tough. You are so bad. Okay, oh yes, I'm bad. Okay, a good tree test. Okay, this good tree test or bacteria inhibition test, bacterial inhibition test is the same. Good tree test and bacterial inhibition test, bacterial growth inhibition test is the same. Is used to diagnose PKU. It is true. It is true. It is a test that is done in the blood of the newborn, but must be done after the child has been eating, breast milk or formula at least 24 hours. Cannot be done while the child has not yet, taken enough doses of milk. So it need to be delayed, postponed at least 24 hours after the child is eating. And this is the test that as a routine is done to any child born uh, to diagnose this condition. Okay, so it is true. So I'm helping you with that. A baby with PKU would have urine with a very high level of phenylpyruvic acid. Okay, it is true. The 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 impossibility of degradation of the phenylalanine in the normal way is going to produce an accumulation of phenylpyruvic acid in the urine, giving a peculiar smell to the urine. They describe that like a musty odor. Okay, like like a mold odor, no? And it is true. This test can also be done in the urine, but it's done like after a week, okay, because it's more sensitive to be done in the blood. Mental deficits result from untreated PKU. Is this true? What you know about the consequences of the PKU? Nothing? No? Okay. Yes,
No
guys.
problem, Prof.
Is
No,
is
intellectual problem, this is
exacto.
brain disease, brain
Is
damage.
exactly can produce brain damage. Can produce brain damage. That's why these and many other metabolic congenital or hereditary conditions are investigated, because then you can have a child with a brain damage, okay, mental retardation, learning disability, seizures, etc., if they are not treated. So if they are not treated. Okay, so with what is interesting is when adequate treatment, this brain damage can be prevented. If a child has the bad luck of being born with this metabolic problem, an adequate treatment can prevent the brain damage. Okay, so the other, or the effects of PKU that we are just commenting that is in the brain can be reversed if proper treatment is started. So what you think, what you suspect is the answer, what is the wrong statement?
Three.
It's no,
It's not reverted. The brain damage
it's not
cannot be
reverted,
reverted.
exactly,
Sí,
yes.
exactly. So can be prevented, but not reverted. Entonces, it looks that the wrong statement is 4. So what is important in this question? This disease must be diagnosed as soon as possible, because if the damage can be prevented, if the disease is diagnosed but cannot be reverted, then they give you the magnitude of the importance of the earliest diagnosis of this disease. By the way, who knows what is the most important part of the treatment? Okay, too much silence. I don't want too much silence.
Diet.
No problem.
Diet.
The
The
diet.
answer
Diet,
is diet. Diet. Very good. This is the answer that must be given. Diet. So the diet, first in the first year of age, is the breast milk. Okay, the human milk is low in phenylalanine. So it's a good milk for this child. So is recommended. If the woman doesn't want or cannot breastfeed, there is an special, okay, formula called the brand name is Lafenalac that has low phenylalanine in the formula. When the child starts having those foods to the milk, so milk more solid food, they restrict, not eliminate, they restrict foods with high content of protein. So you will find that it is one of the rare conditions in which proteins in the diet are restricted, you know? And then for practical approach in questions, usually they give you 4 menus, yes? And in 3 menus, you have a combination of 2 different proteins, like for example, a beef and milk, or Any combination you are going to see there. That you see there are two cheese and ham, for example, two proteins. And then one option has only one proteins, and the rest are healthy carbohydrates and fats. Yes. So this is going to be more or less the question that I seen about how is the dietary management of patients with PKU. Okay, it's not a common question, but it's a question that you can have. Another question that I seen is that they can test you your idea, no, the deep knowledge of the diseases that are screened systematically as a routine in a newborn. For example, you need to know that deafness, to be deaf, not being able to hear, is as a routine screen in all newborns. You need to know that hypothyroidism, congenital hypothyroidism, is as a routine, okay, screen in all the newborns. And there is a long, but really long list of diseases that probably you never have heard before, like maple syrup disease, okay? Short chain fatty acid, okay, disease, galactosemia, etc., etc., etc. Yes, so those are metabolic diseases that are rare, but as the PKU can produce mental retardation mainly, and can be managed if they are early diagnosed, can be prevented or minimize the harm, the manage. There are like 20 something metabolic diseases that are screened together with the other that I mentioned, together with sickle cell disease, etc., etc. Okay. But then for these kind of questions, I'm going to give you a trick. They always give a list select that apply of those conditions. PKU, you already know. Hypothyroidism, you already know deafness, and maybe they see galactosemia. Maybe they see, they say, I don't know, any the weird disease. But then they combine this with varicella. Do you do a screening of varicella in a newborn? Obviously, no. Newborns don't catch varicella. Tuberculosis. Do you screen tuberculosis in newborns? No. Tuberculosis don't catch. Newborns don't catch tuberculosis. No. So this type of screenings, okay, that doesn't make sense, will allow you to recognize what are the diseases that are not characteristic in a newborn and doesn't need to be screened. So this is the way that could be presented to you, these questions in which they explore your knowledge of what must be or usually is a screen as a routine in newborns. Okay, is the help that I can give you about this kind of question. Let's go to the next. The nurse is making rounds in the labor and delivery unit. Okay, it's an OB nurse. Which client requires immediate follow-up? Remember, that is another way of asking prioritization, immediate follow-up. Some people like me, that English is not the first language, sometimes we confuse the meaning of this phrase, a follow-up. Is the one that needs to be double-checked, the one that needs to be assessed, the one to have something non-expected that requires more investigation and maybe interventions. First stage of labor, receiving epidural analgesia, temperature 99.9. First stage, sorry for the typo, of labor, receiving oxytocin, one contraction every 90 seconds. Second stage of labor, respiration rate 28 respiration per minute. Second stage of labor, contractions lasting 60 seconds. What is wrong here? What is not expected that requires follow-up?
The second one have a tachysystole, Professor?
Correct. And the
I'm sorry.
terminology is excellent.
I'm in my kitchen and I'm listening you. So listen, that's why I ask.
Okay.
Is that one right?
Yes, it is that
Okay.
one. So, guys, remember that is responsibility of the nurse that is monitoring a labor, okay? That the patient receiving oxytocin cannot have one contraction as frequent as less than 2 minutes. 2 minutes are 120 seconds. And you need to know that because you know that. If they say 90 seconds, it is 1.5 minutes. So it's less than 2 minutes. So the pitocin, the oxytocin, is given to a woman until the frequency of the contraction reaches the frequency of one contraction every 2 to 3 minutes. When you reach this level, the pitocin, the oxytocin must be discontinued. This is no more that you can get with the oxytocin. This is the maximum of frequency of contractions in a patient receiving oxytocin. So one contraction every 2 minutes is one contraction every 120 seconds. If you're having one contraction every 90 seconds, this is too frequent. And this is called tachysystole. Tachysystole, okay? This is the terminology that they mention for this excessive frequency of contraction induced by the drip of oxytocin. Remember that the fetus is not receiving oxygen during the contractions. If there is not enough rest between contraction and contraction, yes, to allow the fetus to oxygenate, then the fetus can die. The other consequence of having this tachysystole, these excessive contractions, is that the uterus can break, especially if the patient has a previous scar produced by a C-section, a cesarean section. Yes, so this is important. The other is that the contraction should not last more than 90 seconds. Okay, 90 seconds. So there is a difference between frequency and duration of the contraction. When a woman is in labor, comes a contraction that is registered in the graphic like an increment of the pressure of the uterus, and then the contraction subsides. Okay, and then there is a period of rest and comes the next contraction, and this is going to how is going to be seen in the graphic in the register of the monitorization. Okay, the frequency of the contraction is measured since the beginning of one contraction until the beginning of the next contraction. Let me explain. You can measure that with just a watch, with a second hand, watch, okay? So you put your hand in the fundus of the uterus of the woman, and you expect that the uterus become, contracted. Of course, you are going to notice that when you palpate the uterus become hard, but at the same time, you are going to see the woman complaining because it is painful. So now you start counting, okay? 1 minute, 2 minutes. Then in 2 minutes, the contraction subsides. Okay, suppose in 3 minutes, the contraction subsides. So disappears, relaxes. No? But you continue counting. Okay, 3 minutes, 4 minutes, 5 minutes, 6 minutes, and then it starts the following contraction. What you say? Oh, she has a contraction every 6 minutes. 1, 2, 3, 4, 5, 6 minutes. You counted from the beginning of one contraction until the beginning of the next contraction. 6 minutes you counted in this interval. This is the frequency of the contraction. And this is the way that is measured. Can be tested okay, in this statement, how you measure the frequency of the contractions. I measure the physical contraction counting the minutes that pass since the beginning of one contraction until the beginning of the next contraction. Make sense? But also you can measure the duration of the contraction. Then when starts the contraction, you start counting, okay? Okay, you can count in minutes or seconds, preferably seconds, and you say, okay, 1 minute or 60 seconds, 2 minutes or 120 seconds, 3 minutes, 180 seconds. So this contraction that I draw here, because I wanted to do that, is lasting 180 seconds, too much. It is lasting too much. The contraction should not be lasting more than 90 seconds. Okay, 90 seconds is 1.5 minutes. So I represented by mistake this contraction lasting too much because the contraction cannot last more than 90 seconds. Okay, so memorize that. So the contractions usually last from 60 to 90 seconds, last, okay, since the beginning of this contraction until the end of the same contraction, yes? Last, okay, duration, yes? And between 60 and 90 seconds. And you need to know that because it is something that is responsibility of the nurse that is monitoring the labor. It is the nurse that keep track of the frequency and the duration of the contraction. You can measure that in the graphic, but it requires a little more knowledge. Okay, that's why it's more frequent, requires an equipment that not everywhere is available. You can monitor, you can control a labor of a woman without those apparatus, with just a watch. Okay, with just a second-hand watch. Okay, and this is the way. And have the knowledge that the contraction, okay, should not be more frequent than 2 minutes, which is 120 seconds, and should not last duration more than 90 seconds. Okay. Okay. Entonces, this is the knowledge to answer a question that any person could have about this concept of OB. And it's not rocket science, it's something to understand. If we don't stop the pitocin, the oxytocin, when this maximum is reached, then we have the tachysystole, and this is bad for the fetus and could be bad for the mother because the uterus can burst, can break, and suffer rupture. Okay, next. Decline convalescence of a vasectomy asks the nurse when he can have intercourse with his spouse, with a partner, without wearing condoms, without the fear of having an undesired pregnancy. That's why the guy went to the vasectomy. The best nurse response would be, you should wait after 1 week to discontinue any contraceptive. You can have intercourse without protection immediately because the seminal tubes were severed. You can discontinue condoms after having 2 negative sperm count. You must wait at least 30 days to have intercourse without protection. But your answer in this question?
Sí.
Of course.
B.
Sí.
B.
D, D as in diamond,
No, sí.
C as in
No,
cat,
B.
Sí.
I said B.
C as in
Sí
cat.
has some coconut.
Oh, yeah,
As
yeah.
in
Sorry,
coconut,
B.
that's it, that's coconut. Okay, exactly. C, okay, so you need to be sure because then some guys eliminate the sperm store because we have a spermatozoids store not in the testicle, but in the seminal vesicles that are there. So after they sever, they cut the communication between the testicles and the vesicles, the seminal vesicles. Still, they are from previous time. There is spermatozoid stores there in the vesicles, in the seminal vesicles, and you need to have enough time to eliminate all those sperms that are there. So some guys do that earlier, some guys do that later. So the best and the only certain question is use condoms until you have 2 sperm count, 2 spermatograms, zero count, okay? And then you can, relax and be sure that you cannot have impregnate a woman. Very good. The nurse is, I remember that after this procedure, uh, a bleeding, a blood in the sperm is okay, is normal, is not alarming, and there is no contraindication to have sex unless, but with protection. It is what you need to know. Okay. The nurse is evaluating a client with gastroenteritis of 2 days. Okay, so the patient has 2 days with diarrhea and vomit. Which of the following lab values should the nurse prioritize? Which one of these 4 values you think is the worst, is the priority?
C.
Sí.
C like cat.
C like coconut or cat? Okay, any other opinion?
C.
B as a boy.
B as in boy. So you are between these two. Okay. So obviously the potassium is in the lower limit, but it's normal. Need to be observed, but is at this moment is not a priority. We can rule out that. The creatinine is acceptable. So it's normal. It can be. The sodium is low. Is critical?
No. No, it's
No.
not critical.
Critical is 120. But it is low, but not critical. Okay. How much hemoglobin has this patient?
18.
18. 3 por 8, 24, llevo 2, 3, 11. Sí, 18 point something, yes? So hemoglobin, 18. Why so high the hemoglobin? Why so high the hematocrit?
Dehydration.
Dehydration. Is hemoconcentrated. Is seriously dehydrated, is hemoconcentrated because there is too high hematocrit, too high hemoglobin. She calculated the hemoglobin divided 45 divided by 3. That's the way that she calculated the hemoglobin. And we realized, because maybe we don't speak hematocrit, but we speak hemoglobin, that this hemoglobin is too high. And there is a concern that this patient is dehydrated. So if you have this question being 133 non-critical and being 55 hematocrit and evidence of important dehydration, I think that you should give priority, if you have a similar question in your Nclex, to B, to the dehydration, because it's a problem of A, B, C is a problem of C, circulation, fluid volume deficit, hypovolemia, yes? So it looks like this is the priority. The 133 of sodium can be tolerated because it's not critical. There is not, immediate risk of these 3 parameters, A, B, and C, with this level of sodium. So don't you think that we should give priority to the hemoconcentration that is so important? Yes, yes. So this is what we can learn from this question. So remember that a hematocrit and hemoglobin are also parameters that allow us to magnify, quantify the severity of the dehydration through the hemoconcentration. Good. A client diagnosed with hypothyroidism is starting levothyroxine, which is the treatment of this condition. Which of the following statements correlate with an adequate understanding of the nursing teaching? So what is correct? It's a positive question, no? I must take the levothyroxine before going to bed. I will increase my fluid intake. I will lower the temperature of my room when sleeping. I expect that the treatment will require many months before being discontinued. What do you think?
B. D.
Understanding. B as in qué? As in boy.
D.
Or D as in
D as a
David.
dog.
D as in dog, okay? And Somebody said B as in boy.
B, babe, B as in boy.
Okay, B as in boy. So
B.
we are going to contrast it. Let me see why no A. I must take the levothyroxine before going to bed. No, levothyroxine is better taking with empty stomach and in the morning. The rationale is first the food inactivate the medication. Need to be taken with antihistaminic, and you need to wait at least half an hour to have your breakfast, preferably 1 hour. And second, this medication wires you up, activate your metabolism. And if you take that at night, then you can suffer of insomnia. So it is something that we can rule out because it's incorrect. And let me see C. I will put my room cooler. I would lower the temperature of my room. No, because they have hypothyroidism and the patient will be uncomfortable if putting the AC lower. The patient has the diagnosis is hypothyroidism. Okay. So now we have to contrast. It's okay to discuss B and D. Okay. What is the most common cause of hypothyroidism?
Autoimmune disease.
Can you say again?
Hashimoto.
Autoimmune disease.
Autoimmune disease. I sorry, I didn't understand. Remember that I'm very, deaf and very hard of hearing. Okay, so be used to that. You are going to be dealing with a lot of old people in your life. You need to deal with the temper and with the deafness. Okay, so autoimmune disease. She is correct. Autoimmune disease called Hashimoto disease, Hashimoto thyroiditis, Hashimoto thyroiditis. Okay, is the most common condition. More common in women that in men, thyroid, con I, sorry, di, diabetes, thyroiditis, okay? More common in women than in men because autoimmune diseases are more common in women. Usually, relatively young women suffer the Hashimoto thyroiditis, but because it's a very slow, progressing disease, a disease of years, then when those young, relatively young women have middle age or a little more than middle age, is when the destruction of the thyroid gland by the thyroiditis, produces the hypothyroidism. Okay, is this reversible? Can be cured?
No.
No.
Not
So
usually.
is the treatment of hypothyroidism usually a lifelong treatment?
Yes.
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 So sorry, I was saying Hialeah, but this is a disqualifier of this option before being discontinued. Make sense? So we need to read until the end. What is the problem that we have? Okay, it's true. Yes, it's true. Expect the treatment will require many months. Yes, it's true. It's a treatment that it takes time. Okay, but before being discontinued, it means that the hypothyroidism is cured. It's like an infection. No. So that's why we rule out D as in dog. We learned that it is lifelong treatment. Okay, and then the only possible option is B. And why is good to recommend a client with hypothyroidism to increase the intake of fluid?
Constipation.
Because constipation is a classical symptom of hypothyroidism. So fiber, raw fish in the diet and fluids is recommended because the constipation. So at the end is a question that you can perfectly answer, okay, the next time that you have this question, if it is given to you in your English. Good. The nurse receive for clients for admission for, for administration of varicella vaccine. Two persons come to you to be vaccinated for varicella. In which client the nurse objects the vaccine? 8-year-old male with history of Kawasaki at 3, 18-year-old female taking naproxen for menstrual colics, 23-year-old female with elevated ACG, 10 years old living with an old grandparent in chemotherapy. What do you think?
C.
E.
D.
You said D as in dog?
Yes.
Yeah.
Yes, D
Yes,
as in
and cat.
E. Another says C as in cat. Any other possibility? No more? Is there any problem? The history of Kawasaki and the varicella vaccine?
Yes.
Which is the
It's
problem?
autoimmune disease.
It's an autoimmune
It's
disease.
autoimmune
But the problem that it is
and
not is treated.
immunosuppression. With
Is a disease that is reversible. A Kawasaki disease occurs in small children, more frequent in males than females, is autoimmune, but is self-limited, is comes and goes. You understand? Is not stays for the rest of the life. So for unknown reasons, this child will produce auto antibodies and autoimmunity that is going to produce a series of inflammation in the blood vessel, this is vasculitis, including the coronary arteries, is going to produce inflammation in all the skin, a rash and the mucosas. It's going to produce inflammation in the lymph node. So it's going to produce a profuse and systemic inflammation with a lot of fever. But then after a while, the antibodies are not produced anymore and the disease disappears and the patient recovers of the disease and doesn't suffer of the disease anymore. The problem is that while the disease is active, the heart becomes inflamed. There is inflammation of the heart and it can be problems in the heart. Even can leave problems in the heart because if there is a non-treated inflammation of the coronary arteries as part of the vasculitis, those coronary arteries can develop aneurysms and even can become obstructed. The Kawasaki disease has several treatments, including some immune globulins, etc. But the most important is the use of aspirin. Acetyl salicylic acid or aspirin is the cornerstone of the treatment of Kawasaki disease. Nevertheless, this aspirin is given for a period of time after the disease is over and the doctors decide that is no more activity, the aspirin is discontinued. Okay, so the patient with Kawasaki disease shouldn't be considered immune suppressed. I don't agree. It's an excess of immunity that if the patient receive immune suppressors, then the immune suppressor could produce immune suppression. Okay, but at the moment of the disease was when he was 3 and now is 8, so the disease was 5 years ago. What is interesting is that a child that is taking my goodness, why it happened? A child that is taking aspirin when the child was 3. Okay, so 5 years ago, when the child taking aspirin, the child can't be vaccinated neither with flu vaccine nor with varicella vaccine, because when flu, the virus of the influenza, or the virus of the varicella zoster is in the body, if the person takes aspirin, this combination is what produces the Reyes syndrome. Yeah. So children taking aspirin cannot receive the flu vaccine and the varicella vaccine until they stop the aspirin. After they stop the aspirin, they can do, okay, they can receive the vaccine. This child had the Kawasaki 5 years ago, so is not taking aspirin at this moment, can receive the vaccine. This is my defense that this option should be eliminated because it's a distractor. It's a distractor for those people that know that there could be a problem in patients having Kawasaki disease and some vaccines. Because if the people with Kawasaki disease is receiving aspirin, cannot have at that moment the flu vaccine or the varicella vaccine. But once the aspirin is not taken anymore, the patient can have the vaccines. ¿Me expliqué bien? Did I explain correctly myself? It was clear? Okay,
Yes.
Yes.
good. The other problem with vaccines and Kawasaki disease and can be tested, pay attention, is one of the treatments of the Kawasaki disease in the acute phase when 5 years ago is the intravenous administration of gamma globulin, immune globulin. Gamma globulin has demonstrated shortening and improvement, rapid improvement of the Kawasaki disease. When we administer a person gamma globulin, immune globulins, among the activities of the defensive, what is doing this immune globulin, this gamma globulin that is injected? Those are also antibodies, but those antibodies will recognize the autoantibody, the bad antibody that are producing the disease, this bad guy that are bad antibodies producing the inflammation and the disease are going to be recognized by these injected good antibodies and are going to be destroyed by these antibodies. The bad antibodies are going to be eliminated by the good antibodies injected to the child. You understand? So that's why immune globulins are used in the treatment of some autoimmune diseases that are produced by bad antibodies, and these bad antibodies that are attacking at the own person can be destroyed by the good antibodies injected, okay, as immune globulin. But among, okay, those many antibodies that are present in an immune globulin, there are antibodies against the varicella, the varicella. And varicella is a live virus vaccine. So if you have a patient that recently, and this recently is some books I read 9 months, other book I read 12 months. So it's a recent that is not so recent, yes? If a person that is going to receive live virus vaccine, so the virus of the vaccine is alive, is weakened but alive. If the person had in the last X month immune globulin, the immune globulin that received will kill the virus of the vaccine, and the vaccine is not going to work. It's like injecting water. You understand? So this is another interference between Kawasaki, treatment of the Kawasaki, and vaccination. And sadly, I seen those questions in Nclex. That if you know that patient with Kawasaki receiving aspirin cannot receive the flu vaccine and the varicella vaccine until the aspirin is discontinued. And they cannot receive the live viral vaccine until the action of the immune globulin injected as part of the treatment of the Kawasaki disease wears out after 9-12 months. You know that the live viral vaccines, I mean the MMR and the varicella, are given after the 1 year of age, because before 1 year of age, the baby has the antibodies against those viruses, okay, those viruses transferred by the mother, okay, before birth. And we need to wait until those antibodies wears out, that usually happens around 9 to 12 months, to then give this live virus viruses, because if we give that before, probably the mother's antibodies are going to destroy the vaccine, are going to destroy the virus, the vaccine. So this is something that I just explained to you, just in case you have a question, because my philosophy is that you need, for asking the Nclex, you need to understand. You cannot memorize, because they are so uh, competent in changing the questions. So when I heard one student that had one question in the English, then the next student comes with the same question, but now I notice that the question is totally different. It's the same topic, but it's totally different. So there is no question that repeats in English. The concept repeats a lot, but not the question. You need to understand the concept. Why, okay, varicella and flu vaccine cannot be given in a child taking aspirin, and why people that receive immune globulin need to wait 1 year to receive the live viral vaccine like the MMR and the varicella vaccine. Yesterday, one student sent me a question that has in his Nclex, which vaccine protects against mumps? Who doesn't know that? What is the vaccine that protects against mumps?
MMR?
No, Prof.
Of course, no, don't say that with doubt. Say that MMR. Okay, MMR is measles, mumps, and rubella. You need to get what means M and R. MMR. Okay, okay. M is measles. The other M is mumps. Okay, and the other is rubella. Okay, so what's the question then? So it's a basic question. Yeah? Okay, so so that's why I disagree. I disagree with you, and I defended that. I explained that the best that I could. Why one is a contraindication. There is no problem because this child has Kawasaki when it was 5 years ago, and now is not having neither the immune globulin nor the aspirin can receive. The naproxen, which an NSAID, doesn't interact with those vaccines. So I agree with you. So now we have a child that is going to receive the vaccine and is living with an old parent in chemotherapy. Okay, so now the child cannot be vaccinated because is living in the same house of a grandparent that is receiving chemotherapy. So you need to have this quotation mark here. What means that a woman has elevated ACG? What is the most common cause of elevation of the ACG?
Pregnancy.
Pregnancy. So this woman is probably pregnant.
It's pregnant.
And this is an absolute contraindication of receiving live viral vaccines, because the live viral vaccines in the first part of the pregnancy can be teratogenic, including varicella. So we need to contrast a child that is living in a house with a grandparent that is in chemotherapy. This grandparent very probably is immune against varicella. You know that it's considered that any person that was born before the 1955, I think 1955, is considered immune to varicella because probably had the varicella. And the new generations, okay, from the 80s and now have been vaccinated. So this grandparent probably is immune to the varicella, and is very, even being in chemotherapy has a very low probability of catching varicella. But in suppose that the viejo, the grandparent, is not immune against varicella, very simple, you cannot deprivate this child of having his vaccination. The only thing that you need to recommend, avoid, direct contact with your grandparent. So there is not an absolute contraindication. The one that is an absolute contraindication is the pregnancy. So next time, please don't allow this elevated ACG catch you without recognizing that this is the same as pregnancy if they are talking about a woman of 23 years old. I know there are some conditions that can produce elevation of the ACG that is not pregnancy, but are rare. The most common is pregnancy, and this common sense. So this is the defense of this question. Notice that those concepts that we are discussing can help you answer other type of questions. Which of the following is a presumptive finding for pregnancy? Remember that pregnancy, they are presumptive, they are probable, and they are positive signs. Yes, this is an asking for presumptive. Which one of these do you think is presumptive?
D.
Yes.
D.
D.
D as in dog, breath changes, okay? Breath changes. The auscultation of fetal heart tone is what type?
Positive.
Positive.
Positive, without doubt, okay? Braxton Hicks and elevation of ACG are probable, okay? So breath changes are presumptive, okay? Presumptive, okay? A nurse observes that a patient total parenteral nutrition solution is infused too slowly. It is calculated that the patient has received 30 milliliters less than what was ordered that day. So there is 30 milliliters behind. The nurse should assess the infusion system, note the patient condition, and notify the MD. Increase the flow rate to infuse the additional 30 milliliters in the next hours. Maintain the flow at the current level and document any discrepancy. Discontinue the TPN and admit a D10W until the infusion problem is resolved. What do you think is the best answer to this question?
A.
1.
A.
Okay.
1.
So
Yeah, number
obviously, 1 or A is the best option because it's the one that first assess the problem, why it is happening, assess the patient, how this problem is affecting the patient, and discuss the situation with the doctor. Doctor and the nurse will discuss what we can be done depending of how the patient is. So let's see. What could be happening to the patient that is receiving this deficit, is receiving less TPN? What is the complication that could develop the patient?
hypoglycemia.
Hypoglycemia.
Hypoglycemia. Correct. So you are good with the concept. Okay. Hypoglycemia. Very good. Very good. Okay. The other options, you cannot speed up the rate to catch up because it's not allowed, it's not recommended, and then can produce the opposite, can produce hyperglycemia and fluid volume excess. That's why it's totally incorrect. Maintaining the flow is and documenting is ignoring the problem, is doing nothing. Okay, and there is no need of discontinuation of the TPN because you need to discuss with the doctor what is going to be done. Okay, after you assess what could be causing the delay, is a pump malfunction, is a catheter malfunction, is a calculation, mathematics calculation mistake, and discuss with the client the patient condition and decide what to do. Okay, it's the best option, not no doubt. So it's a question that is simple, it's a management question. A patient is receiving an intravenous potassium bolus infusion. Okay, so probably what we can assume, the patient had low potassium and is receiving by doctor's order an intravenous amount of potassium receiving. Yeah, the cardiac catheterization lab calls for the patient to be sent for cardiac catheterization. So now calls the cardiologist, interventionist cardiology from the cardiac cath that send the patient that is due for cardiac catheterization. Okay, a nurse should do which of the following: stop the potassium infusion, and restart when the patient returns from the cardiac catheterization. Notify the prescriber that the patient is leaving the unit on IV infusion. So cardiologists take care the patient is having IV potassium drip. Send the patient to the lab with infusion along with the oxygen tank and the back valve mask device, and notify the lab that the patient will be sent after finishing the infusion. What do you think is the best option in this scenario?
4. 4.
1.
Okay. So you have 1 and 4. So let's see. 2, notify the prescriber that the patient is leaving the unit on potassium infusion. Hey, cardiologist, take care of my patient because it's going to use with an IV drip of potassium, and you know that it requires continuous monitorization because the potassium is a very delicate, okay, infusion, you know? Okay, so doesn't like, correct. You are not passing the buck to the cardiologist. Send the patient with the oxygen. So it has nothing to do with oxygen. So it is a nonsense. It is an easy one to rely. Okay, it's between 1 and 2. I agree. So why the patient is receiving a bolus infusion of potassium? Because the potassium is low. Is there any risk in stopping the infusion of potassium before is finished, before the hypokalemia is corrected, to have a surgery or having a catheterism? Is there is any risk in this decision for the
Yes.
patient?
Yes.
Yes, because we know that low potassium is associated with cardiac arrhythmias. Yes, and is a safe intervention, telling the people of the catheterism, hey, I'm so sorry, but the patient is more important than your schedule. Yes, you can be very upset, you can be very, but this patient was diagnosed with hypokalemia and the doctor ordered a bolus of potassium. I'm so sorry that you need to change your schedule, but the patient is first. In the Nclex, who is first? The patient or the people in the cardiac lab that are very upset, threatening you, insulting you? What is more important?
Patient.
The patient. So now, what you decide is 1 or 4?
4.
4.
4.
Everybody
4.
agree that 4 is the correct. 4 is the correct. Makes sense? Because you cannot send a patient without supervision with a dripping of potassium because it is very delicate. Always the potassium need to be dripped in presence of a nurse, under the supervision of a nurse. You cannot send the patient to see what happened there, okay? And you cannot pass this responsibility for the people of cardiac lab. And stopping the IV potassium to comply with the schedule of the cardiac catheterization lab. I'm so sorry, but it implies risk for the patient. And if this patient is somebody that is important for us, we don't like that. Yes, and that's it. Always in Nclex, the patient is the priority. Okay, so this is the way of. Do you understand that in the Nclex, in a test, you can do the same that we are doing now? We rule out the stupid options, and then we usually are left with two possible possibilities. So two possible, it's a redundant, two possible options. Yes, and we can make them compete. So I think that is healthy when the students is left in the question with two options that are probable. When one student thinks that is 1 and one student thinks that is 4. Yeah, because it is the healthy stuff. And then after you have these two possibilities, that is generally the situation in the nursing question, then you make the two possibilities compete. And when it's still difficult for you, say, okay, this is my papa, this is my mama, this is somebody that is very important for me. What I like to do, okay, it is where my mama, okay, and try to understand, no, try to understand what their words are saying. So those are strategies that you can use. Okay, 50-year-old woman comes to her primary care provider for an annual examination. Her last colonoscopy was 1 year ago, and her last mammogram was 13 months ago. The nurse would recommend which of the following screening tests. Read the 4 screening. I'm very sure you can read that. What of this is the best recommendation for this patient?
One.
Okay,
Number one.
one is correct, but incomplete because WIAC test is recommended annually, even if you have colonoscopy. So you need to be between 1 and 4. You don't need sigmoidoscopy,
The
obviously.
WIAC is the blood in the stool.
Fecal
I
or cold blood.
forget that. I'm
Fecal or
sorry.
cold blood. Oh, good then. So good opportunity to remind you that WIAC test is the same as fecal or cold blood that is recommended annually. Yes. So pap smear and WIAC test is ignoring the mammogram that is due. And so we rule out 3 because sigmoidoscopy is not needed. We rule out 2 because it's ignoring mammogram, because the mammogram is the most important that is due. So is 1 or 4 because it includes mammogram, includes pap smear. But then 4 includes the WIAC test. And you need to know that the WIAC test of fecal or cold blood is recommended every year. Independently, you have your colonoscopy every 10 years, or your sigmoidoscopy every 5 years, or your barium enema every 5 years or 3 years, no, 5 years, 5 years also. Yes. So what is more complete? 4, because it's including the WIAC test. This is um, this is the defense of this option. Yes. Um, um, okay. The American Cancer Society and American College of OB and Gynecology recommend that women age 50 and over should have annual pap smear and mammogram. Lo de pap smear annual have changed, no? But it's probably due on her. And colonoscopy every 10 years with fecal or cold testing annually. Okay, so this is a detail. Okay, a detail. A nurse is caring for a gravida 3 pregnancies. Para 2 had 2 babies, so is pregnant now. No? 29-year-old female. Which of the following findings will be the nurse considered abnormal? Self that apply. Okay, very good. So time, so it looks like it is in labor, no? Because it has contraction. Time between contraction of 15 seconds
Yes, that's abnormal.
is abnormal, it's horrible.
Super abnormal.
Should be 120 minimum seconds, yes? Okay, 120, 180 is the ideal. Between contraction, 2 to 3 minutes, okay. Uterine wall remains firm and hard after each contraction.
That's abnormal too, because this is
Is
una contracción mantenida.
exacto, is also
Continuous
abnormal.
contraction.
Should relax the uterus between contractions. Don't forget that is between contractions when the baby can breathe, can obtain oxygen from the placenta. While the contraction occurs, the blood flow in the placenta is interrupted. Fetal heart tone is 145.
That's okay.
Normal.
It's, it is okay. 120 to 160 with periods of accelerations are okay. Late deceleration is considered
That's abnormal.
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 This is abnormal. Early deceleration,
That's okay too.
Normal.
that's okay. So, an easy one. An easy one. Okay. What acid-base imbalance? Okay, there is an echo of a horrible voice there. I don't like the voice of this guy. Okay, cancel this echo. What acid-base imbalance would a nurse expect to find in a client with myasthenia gravis crisis? Okay, I'm not going to read them because it's not. But which one of you think is compatible with a myasthenia gravis crisis?
Three, Professor.
Two, 2B.
Okay, so I
3.
have 2 and 3. Okay, so what produces myasthenia gravis? What is the consequence of the myasthenia gravis that can affect the acid-base balance? What kind of problem?
Respiratoria acidosis.
Respiratory paralysis.
Exactly, paralysis of the respiration. So decreased hypoventilation. See, hypoventilation can be summarized. So the muscle weakness in the crisis, make the patient move air in and out with difficulty, and for that reason there is hypoventilation. Which one is the parameter that defines better the hypoventilation? The CO2 or the bicarbonate?
CO2.
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 If the patient is hypoventilating, what happens with the CO2? Increases or decreases?
Increase.
Increases.
Increase.
So we need to find a CO2 that is high. Yes? And because the CO2 that is high, because the patient is not breathing, because the CO2 is high, the pH must be low because the CO2 is acid. Yes, CO2 is like lemon. Yeah, the pH will be low because there is an acidosis. So it's a respiratory acidosis. So the only one that has low pH with high CO2 is this. Okay. Maybe the patient is receiving oxygen by nasal cannula, and for that reason, the oxygen is in acceptable range. But the only one, the acid-base balance, that is explaining the respiratory acidosis because retention of CO2 is this. So when we have problem of hypoventilation or hyperventilation, we need to follow the CO2, not the oxygen. Okay. A nurse has just received a call from the emergency department regarding several emergencies admissions. To provide adequate care of these acute ill patients, the nurse plans to discharge which of the following patients? Okay, it's a very common question in English that you need to choose a patient that is the most stable to discharge, to open a space, open bed for new admission. A patient who had cataracts removal 8 hours ago. A patient with Graves' disease had blood pressure 140/90, heart rate 124, respiration 24. A 34-week pregnant patient with contraction 5 minutes apart. A patient with sickle cell anemia complaining of pain in the hands and abdomen. Which of these patients can be discharged?
Number 1.
1.
Number 1. Number 1, usually cataract surgery is the ambulatory surgery, and if the patient has already recovered of the local, usually your local anesthesia is recovered and is stable, can be discharged. The other patients are unstable. The patient with Graves' disease is decompensated. The heart rate is what tells you that the patient is decompensated. Okay, the heart rate is what is telling you that the patient is decompensated. The patient that is in labor, don't send that home because you are going to have a baby born at the home. It's no good. And the patient with sickle cell disease having pain is obviously having a vaso-occlusive crisis. So this is easy one. A nurse is participating in health fair for young parents. A young father states that he has seen all sorts of advertising from car manufacturers regarding how children should sit in the back seat. He wants to know at what age his child can safely sit in the front seat. Then the responded, the CDC recommend that only children older than years of age may ride in the front seat. The answer is
3.
13.
3. Yeah.
13. So, okay, if the child is already older than 13, can move to the front seat. A family present to their healthcare provider with 3 children aged 4, 6, and 3. The children are not energetic and have pale conjunctiva, like anemia. No? 2 of the children suffer of seizures and chronic abdominal pain. The family live in a single-family house built in 1960 with city water and sewer. The mother described a well-balanced diet except for a sweet tooth. The nurse realized that the children may be suffering from mercury poisoning, salmonella infection, lead poisoning, or histoplasmosis infection.
3.
Okay.
Lead
And
poisoning.
what makes you suspect lead poisoning of all this stuff?
The house is built in 1960.
Okay,
The,
it is an
the
old house. Okay, it is an old house. Because it's true, the anemia, the abdominal pain, the seizure can also be explained by lead poisoning, but also can be explained by other conditions. But calls the attention that all the children are sick. So it is probably an environmental situation because all the three children are sick. But the detail is the old house. Old houses, okay, have the tendency to have lead in their paint, in their plumbery, in their pipes, etc., etc. So that's why should be ruled out in this situation lead poisoning.
Professor,
Absolutely.
what is the meaning of lead?
Can you repeat? I couldn't hear you. You're breaking down, breaking up.
Oh, I'm sorry. The meaning of lead.
Oh,
plomo.
lead, plomo,
Oh, okay.
plomo.
I understand.
Intoxicación por plomo, okay. What is the only metal that can block the gamma rays that emit ¿cómo se llama? A radioactive implant placed in a woman with cervical cancer, etc. What is the only metal that can block the gamma ray?
Lead.
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 Plum.
This one,
Lead.
lead, the same. I just wanted to create
Lead.
memory, no? I'm just trying to create memory, so you start connecting concepts, no? For that reason, when a nurse enters the room of this woman that has a radioactive implant, should be wearing a lead apron, yes, with including collar, see? Okay, and that's why you need to have in the room a container, a lead container, no? A lead container with lid. But since the implants comes out, you take that with tongs, and then you put that inside the lead container, yes? So lead, plomo, okay? If you were older and you were fan of Superman, like my generation, you know that lead also blocks kryptonite, but you don't know what is that. Okay. During admissions interview, a patient's eyes deviate upward and convulsion begins. Which of the following action taken by the nurse will be appropriate? Cellular apply. So the patient is sitting in front of you. Okay. So okay. So restrain the patient. Yes or not?
No.
No. You leave the movement to move freely. Loosen restrictive clothing.
Yes.
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 True.
Especially ties, okay? Especially ties and collars. Clear area of hard object.
Yes.
Yes.
Of
Yes.
course. So in the jerking, in the movement, the patient is not traumatized. Hold the patient to a lying position.
Yes.
Yes.
Yes, because if the patient is starting having the seizure and is standing, it's going to fall and is going to have trauma. Slide a tongue blade into mouth to protect the teeth.
No.
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 No. Okay, you put your finger, no, a tongue blade. Yes, and then they are calling you, la mocha. Okay. Uh, place a small pillow under the patient head if once is in the floor.
Yes.
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 Okay, an easy one. An easy one. After exploring the cranial nerve and asking the client to look to the right, remember that this is right and this is left. Okay, is the opposite because the patient is in front of you. Yeah. The nurse concludes that the client has affected which cranial nerve. So look at the patient. The patient is asked to look to the right and to the left, and you need to detect. So you need to decide which one is affected. You say B as in boy.
D.
No,
D as
D as in David.
as in David, right? 6. Okay. Do everybody agree? Okay. I also agree. I also agree. Okay. The 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 nerve that innervate the muscle, that is the abductor, that obviously is failing here, is 6, the abducens. So there is a failure to abduct the right eye. For that reason, this is the cranial nerve that is failing. Okay, and by the way, this is the most commonly affected cranial nerve, producing strabism paralysis, and is the most common that I've seen tested in Nclex, because the ocular movement are very complex. You have a muscle that move the eyeball upward, and another that move the eyeball downward, a muscle that move the 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 eyeball inward, a muscle that move the eyeball ¿cómo se llama? Outward, and a muscle that move the eyeball to see the tip of your nose. These and these are innervated by the third, these by the sixth, and these by the fourth, the trochlear. Yeah. But I think that is not so important to know so many. I think that at least for the test purposes, to understand that the one that made the abduction of the eyeball is the sixth, because it's the one that is more frequently affected and the one that is tested more frequently. This is a very long nerve, the sixth cranial nerve, and for that reason is the most commonly affected by neuritis and tumors or increased pressure. The next is the third cranial nerve. Which nerve of this, which nerve controls the pupil, the contraction of the pupil? Which nerve
Three.
ah?
3.
Oculomotor.
3. Oculomotor, the 3. So it's very important that this saying that is to move up, inner, and down, also control the pupil. The contraction of the pupil, not the dilation. The dilation is controlled by the sympathetic nervous system. But the contraction of the pupil, closing the pupil in response to the light, is the 3. Okay. A client arrived unresponsive to the ER with pinpoint pupils and hypoventilation, showing marks of venipuncture on both arms. The nurse suspects heroin addiction. What should the nurse prepare to administer next? What color the white horse Napoleon?
C.
Naloxone.
Naloxone. Okay, naloxone. Okay, naloxone. In this patient, later could be used methadone. Why?
For the long for the substitute for the heroin.
As a replacement of the heroin, okay,
Yeah.
and to prevent the
Less
withdrawal,
cravings.
the acute withdrawal of the heroin. Yes, for the management of the acute withdrawal of the heroin. Yes, and to make the patient, stop using heroin, which is a very risky drug. Okay, okay, good, very good. The occupational nurse is giving a conference of toxicity prevention to a community of agricultures. The nurse explains that herbicides and insecticides could, in some cases, increase the risk of developing which the following condition: myasthenia gravis, major depression, Parkinson's disease, Guillain-Barré. What do you know about that?
Sí.
Yes. Yes. Especially the paraquat. The paraquat. Okay, the paraquat, which is a herbicide, has been associated with Parkinson's disease. Parkinson's disease. Take care. This has been in Nclex. This concept has been in Nclex. Okay. So whoever doesn't know that is you can find that in the news. Okay, in the news. Okay, so there is some cases association between Parkinson's disease and the chronic intoxication with insecticides and herbicides. The nursing student delivering a conference about dehydration in adult client explained that this age group is an increased risk for dehydration because which of the following factors? Why we old people are at higher risk of dehydration? Increased metabolic rate and water need, decreased intestinal motility and rate of water absorption, decreased osmoreceptor function and thirst sensation, decreased urinary water excretion, and increased need for extravascular fluid.
Sí.
Yes, in cat.
Sí.
Okay, you're good. That's the reason. Okay, we don't feel the thirst as when we were younger. And for that reason, when we are dehydrated, we don't drink water. When you are lightly dehydrated, immediately you have a lot of thirst, and then you start drinking water. But then we can be dehydrated and we don't yet feel the thirst because the osmoreceptors in the hypothalamus are older. And that's the reason for which there is, among other reasons, also we have less water reserves because we have less muscle and more fat. The muscle has a lot of water, so there is a reserve of water, but the fat has no water. When we grow older, we decrease muscle mass, okay, and we increase adipose tissue. The other reason is that we concentrate less efficiently the urine. So we have increased urinary water excretion. Increase urinary water excretion. We don't save as efficiently the water in the urine as younger people. Yes. And for that reason, we cannot save water so efficient. So we don't respond so well to the antidiuretic hormone than younger people, than when younger. The nurse observed the following cardiac monitor rhythm in a client with recent syncope and feeling like fainting. And then you have this rhythm. Which of the following interventions the nurse knows are appropriate for this client? Cells that apply. So first, what you notice in this EKG?
Bradicardia.
Bradycardia are 1, 2, 3, 4, 5, 6.5 big boxes. So more than 5 is bradycardia. Seems a sinus bradycardia because there is big wave and there is regularity, but it's a bradycardia. And the question is stated that the patient is symptomatic. So the patient has a symptomatic bradycardia. Yeah, so needs intervention. The first question that I would ask this client: are you taking any medication? Are you taking beta blockers? Are you taking calcium channel blockers like diltiazem or verapamil? Are you taking dioxin? Are you taking any chronotropic negative medication? What would be my first question? Maybe it's not taking medication and this is a condition, intrinsic condition of the heart, and the cause of the bradycardia. But the first question I would ask the clients, are you taking medication? But the problem is symptomatic. So what I can do for this patient? A, encourage Valsalva maneuver, yes or not?
No.
No.
No, the Valsalva maneuver
Ratification.
will lower, okay, the heart rate even more. Prepare for external pacing, yes or not?
Yes. Yes.
Yes, because the
Yes.
patient is symptomatic. The external pacing is a transient pacemaker that is placed in the skin through pads, pads that can produce external electrical stimulation. Administer the prescribed carvedilol, yes or not?
No.
No.
Yes.
No, because it's a
No.
beta blocker and it's going to worsen the bradycardia. Only,
Yes.
only, only, only if it is your mother-in-law. Okay? Only, yes, only if your mother-in-law, but not to a patient and not in the Nclex. Okay? But other, you do that only for your mother-in-law. Okay? Initiate chest compressions as soon as possible. Yes or
No.
not?
No.
There is no need of chest compression. Okay, there is no need of chest compression. Assess for the presence of chest pain. What do you think?
No.
Yes, there is no harm. There is no harm in making this question. It's not contraindicated. Why this patient could be having chest pain? Well, you can say, well, because the patient can have a myocardial infarction. Okay, you need to know. You need to know that there are some type of myocardial infarction that can produce bradycardia or AV blocks. The SA node, okay, and the AB node receive circulation and oxygenation, are cells that need oxygen and blood as all the cells of the body. And this circulation comes from the coronary arteries, specifically for the right coronary artery in the majority of the patients. So when there is an obstruction of the right coronary artery that is seen more frequently in the lower part of the heart, the diaphragmatic, okay, side of the heart, or right ventricle infarction, you can have bradycardia. So it's pertinent. And apart of that, if you have a person with a bradycardia, maybe the heart rate is not enough as to irrigate properly the myocardium, and then could be having chest pain. So it is something that is not going to harm, and it is a healthy assessment to be sure that this patient is not having myocardial ischemia that will transform the situation in a more emergent priority. Yes. Okay, prepare to administer the medication isoproterenol. What do you know about this medication? Okay, the isoproterenol is a medication that you need to know. It's a
Es un beta
beta,
1 agonist.
it's a beta 1 agonist. Beta 1 agonist. And the SA node have beta 1 receptors. If you stimulate the beta 1 receptor of the SA node, the heart rate will increase. So the P wave are going to be more frequent, more frequent. And of course, the QRS more frequent. So it as an alternative to the atropine, because the other classical is the atropine, no? The atropine that blocks the vagus, blocks the parasympathetic nervous system because it's anticholinergic. So there are two possibilities, atropine or isoproterenol. Both are going to do the same at the end, are going to speed up the heart, are going to increase the heart rate. But in the case of the isoproterenol, is doing that through the stimulation of the beta-1 receptor of the sympathetic nervous system, while the atropine is done by blocking, antagonizing the acetylcholine of the vagus nerve or parasympathetic nervous system. But at the end, it's the same. Atropine or isoproterenol are the two medications that you anticipate could be prescribed by the doctor before deciding if the patient needs a permanent pacemaker or not. The nurse is evaluating a client to whom it was prescribed prednisone for lupus nephritis. Which of the following secondary effects the nurse should monitor? Well, in which disease you should think in this question? Eso malo está para copiarse. In Cushing disease. Okay? So the answer that you should give to me when they ask you, if you have in your Nclex a question like this, that somebody is receiving glucocorticoids, in which disease you should be thinking to answer the question? Cushing disease. I think that you already studied Cushing disease. Most of you know Cushing disease. And if a person is taking, okay, glucocorticoids, are going to develop secondary action and secondary effects similar to the symptoms of the problems of the Cushing disease. Okay, so it is a strategy that maybe could help some of you. Okay, okay, thinking Cushing disease, hyperkalemia, yes or not?
No.
No.
No,
No.
because in Cushing we have hypokalemia.
Hypokalemia.
Hyperglycemia, yes or
Yes.
not?
Yes.
Yeah.
Yes, because
Yes.
in Cushing we have hyperglycemia. Susceptibility to infection, yes or not?
Yes.
Yeah.
Yes, because in Cushing we have immune suppression. Psychiatric disease, cuckoo-ness.
Yes.
Yes,
Meh.
because
Yes, yes.
you need to know that the
Anuncio.
glucocorticoids produces anxiety, insomnia, emotional lability is very classical psychiatric problems in patients with Cushing. And also you will notice that in patients that most need to take glucocorticoid for a health problem. And you are going to hear from those patients, I don't like taking prednisone because I am not myself. I becomes different. My mind becomes very unstable, becomes very, it affects a lot the mind of the people. Hypertension,
No.
No.
No,
no,
it's
because
No.
coaching give
hypertension.
hypertension. Risk for fractures,
Yes.
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 yes, because you have osteoporosis
It-
of low bone density in Cushing disease. That's why I told you that it helps, okay, thinking in Cushing disease. When you have a question like this, which side effect just do anticipate in patient that must take glucocorticoids? The labor and delivery nurse responds to the call of a 38-week gestation client in labor and found that the fetus head is already out of the vagina. I don't know if you ever seen a birth. I suggest you to do that in YouTube if you've never had. It's a wonderful experience, but then the majority of the babies gone from the head first, so encephalic position, and then the first that is coming out from the vagina is the head, and then you have the head of the baby, okay, but it's not looking at you, it's looking downward, and then the head alone turns to the side. What you need to do when this head is outside and still the rest of the body is inside, what you do first, because when you say what intervention should be done next, is like first. What you do first when the head is out, if you are the nurse that for any reason need to receive this baby.
A.
A.
Hold the
A.
head while gently guiding it out too fast. Okay, so A. What other?
B?
C as in cat.
No, B, B. B as in boy.
Oh, B. Sorry, B. Okay, B. Add the mother to push down with the neck contraction. Any other opinion? Okay.
D.
D as in diamond. Extract the top shoulder first and then the posterior shoulder. Okay. So obviously you don't consider necessary, okay, to work in the mouth and the nose of the baby when the head is out. Okay. What is the priority? Okay, the babies are born because you pull the baby or because the nature has this already taken in consideration and they find a way of pushing the baby out even if nobody is pulling. Tell me this answer. What do you think? Babies come out alone or because you pull the baby out?
No, the baby coming out
Alone.
alone.
They come alone.
If it's
The only
really
thing
sick.
that you need to do is to be holding those babies, so be sure that it's not falling on the floor.
Yeah.
But babies come alone. Okay. And meanwhile, the head is out, they are receiving oxygen because they are still connected through the umbilical cord to the placenta. Don't think that they are cyanotic in this, not cyanotic, hypoxic in this moment because they are receiving still oxygen. So it's a wonderful, the moment of this expulsive, this is something that everybody's very happy. The mother, everybody, yeah, and you see for the first time you see the head of the baby, yes, okay, and then in the next contraction, generally, okay, the babies come out. So you don't need to do, if you need to for emergency attend a birth, uh, you don't need to pull the baby. You only need to hold the baby and allow nature to go on. the baby will rotate along without your need of your movement. The baby will, take out first the anterior shoulder and then the posterior shoulder. You don't need to do that. Of course, you have an expert midwife, etc. You can't do that very quickly because you know what is going to happen. You don't need to do anything. But don't forget that the priority number one of the baby when it's born is which one?
Aspiration, ABC.
The priority
Vigil.
of a baby is to breathe. So the priority of a baby at the moment of birth is to start breathing for the first time air in their life. This is the priority. You need to have this concept very clear. Yes? So have in your mind, when a baby is in the uterus, needs to breathe? No, they can breathe when they want, occasionally. And what they breathe is amniotic fluid, like the fishes. Yes? Are we good? But they breathe from time to time. So they don't need to breathe. Because why they don't need to breathe? Because their brains are happy with the amount of oxygen that is arriving through the umbilical cord. You understand? But then when the baby is out, okay, soon is going to become upset because the stimulation, the cold of the air, the touching of the baby, and then will become upset and will start breathing for the first time. How babies breathe the first time, how they breathe the first time, you know that?
And the patient cry.
Is crying. So the babies start breathing, generally crying. And how they cry, how they take air to cry, through the nose or to the mouth?
To the mouth.
Through the mouth. So do you want, when they for the first time take air for first time, to have a mouth full of fluids and stuff?
No, of course not.
So the first that you do as a nurse when the head is out is to clean the head with a sterile compress and to suction with how you call that, spare? No, it's a pear. To suction the mouth with a pear. Yeah, mouth and nose. So this is the first that you are going to do. So when the rest of the body, because they don't cry when they take the head out, they start crying when the body is out. They feel the cold of the air and the touching that you start touching them. Nobody has touched this baby, has touched this baby before, and they are coming from a swimming pool, from a jacuzzi that is very warm. Yes, and now that's why they start crying. But when they start crying, okay, they are going to have the mouth full of liquid and stuff and secretion, vaginal secretion, etc. And it's good to clean the mouth before they have the first breath. So the answer of this question is the one that you didn't select, is C as in cat. The rest is automatic. The only thing that you
But
are going to, yes,
Professor, I
yes.
think the question is incomplete because
Oh,
the fetus head is already out, not the body, just the
no,
head.
we're not, bro. The head had the mouth. You know, the head had the mouth.
But in that case, the baby is not crying.
Yes, but that's why you, before the baby cries, you suction the mouth to have the mouth clean at the moment when the baby start crying. You understand?
You you suction
Yeah,
the
but
mouth in the vagina.
No, when the head is out of the vagina. Okay, let me
That's
make it.
what.
Let make a picture. Okay, this is the vagina. Yes,
No, la
and
pregunta
now,
está incompleta.
okay, this is your opinion, not my opinion. So we are in a democratic country. We have, okay. So this is the situation. Okay, the purple stuff is the vagina, and the head is out. Do you understand that the head is out, or you don't understand the head out? The rest of the
Yeah,
body
yeah,
is inside the vagina. Yes, the head is
yeah.
out. Okay. Este, go to
In that,
you go to YouTube and click to see a birth. You see how beautiful it is. It's beautiful. It's something that is, it's not
okay,
impressive. Something beautiful. Okay, and
Okay, Professor.
yes,
When
sir.
you finish the explanation, I wanna give you my point of view. Okay.
Okay, no,
About
no,
it.
go ahead, go ahead. Give your point of view. You can give that.
Okay. Um. Um. On my little knowledge about birth, you have to wait until the baby is out for um suctioning the nose or mouth, because
Mm.
That's what I'm saying.
you're gonna stop the baby. If it, hold on. If the mother in that moment start to pushing because you have a contraction, you can lesion the baby neck when they have to rotate. For that reason, you have to wait until the baby is out.
Um, interesting
Okay.
opinion. Interesting opinion, but you know, um, um, interesting opinion, but I think that should be documented. I think should be documented because
Okay. But
okay,
with
I think
device
that
is
you can investigate that. You can start reading,
yeah, yeah. I want
investigating that. Okay, because
to
okay, maybe when you investigate, you discover that it's a routine that when you are sitting in front of the mother is in ¿cómo se llama? Lithotomy position. When the head is out,
Mhm.
immediately you clean the head that comes with a lot of secretions. Okay, you suction very quickly the mouth before the nose, and then in the next contraction that is going to comes in 2 minutes, then generally with the best next contraction comes out the rest of the baby. And you into these 2 minutes, okay, you don't need to traumatize the baby because you with a soft rubber tip, okay, a bulb, you suction the head of the baby. You know, those are, I don't know if you know those bulbs that are available always there in the birth equipment, you know, that you use in the moment that the head is out to suction the mouth. And when the baby is out, then is moved when the umbilical cord is severed, is moved to the bassinet where there is going to be suction with a regular suction catheter with negative suction. But there is no reason to traumatize the neck. The baby rotates alone, and you are not going to traumatize the neck for that reason at all. What is not good, okay, is holding the head while gently guiding it out, not too fast, because there is when an experienced nurse could, produce interference. Uh, uh, you do this before the next contraction. That's why it's first. And you don't pull the shoulder, okay? Because as I said, it is something that is going to happen spontaneously, okay? That is accelerated only by expert people. If there is any reason for to take the babies quickly out because it's coming with distress or something like this. Otherwise, those babies come, those movement occurs alone. The rotation of the head, etc. All everything occurs alone. So, well, there is a different opinion. It's very common in this field that people have read or have any kind of knowledge that say, no, we don't suction. But the rationale that you can have for suctioning the mouth of the baby is because the mouth is full of liquid, and the baby must breathe. Okay, so that's the rationale of that. Okay, but now you have a homework. You now have something to investigate to see why is that is contraindicated. Why is contraindicated? Contraindicated. Suctioning with the bulb that comes in the equipment. So we don't use more this bulb anymore. The baby when the head is out. To be sure that when they is totally out, when the rest of the body comes out, that the baby, when it started crying, when the baby is totally out, have the mouth clean and is not going to aspirate this stuff that is in the mouth, that is vaginal fluids, etc. Okay, so need the homework, need to investigate that. And the other homework is to see in YouTube to see a birth. So now you understand why the head comes out first and the body is inside the uterus and the vagina, and how then rotate along, and then comes the next contraction, and generally in the next contraction comes out the rest of the body. And the natural birth, when there is not emergencies, is to allow everything to happen alone. The only thing that you do is to receive the baby, so you prevent the baby from falling on the floor. Okay, and that's it. Okay, so observe a birth in YouTube, okay, to see how it works. Let's see the next. The nurse is evaluating a client admitted with head trauma and subdural hematoma. Okay, head trauma and subdural hematoma. Which of the following findings requires immediate follow-up? So what is the most serious, okay, situation here? Presence of oculocephalic reflex, also called doll's eye. Intense vertigo with position changes. Blood pressure 89/60. Y bruise around both eyes, raccoon sign. What is the most serious problem here?
E.
Sí.
Sí.
Cat.
C as in cat. Everybody agrees?
Yes, yes.
Yes.
Everybody agrees. Okay, I agree with you. Okay, this is the most serious situation here. After you saw that a patient that just having, a raccoon sign, not necessarily is critical. Patient who have vertigo is very common after head trauma, and being the positive oculocephalic reflex an adequate sign is not a sign of brain death. The most serious here is the hypotension. That, of course, is a hypotension and produce decreased blood flow in the brain, and the brain is having increased intracranial pressure. If inside the brain, in this cavity, the pressure is increased and the pressure of the blood to flow inside the brain is decreased, then we have a problem. The brain will not receive enough blood and is going to have more harm. So the priority here is the hypotension that this patient is presenting. Okay, I agree. The nurse in the hemodialysis unit is educating a client diagnosed with hepatitis C. Which of the following client statements indicate understanding of the teaching? I could have acquired the hepatitis consuming raw oysters. I'm very concerned because there is not antiviral treatment for hepatitis C. I could get contaminated during a previous hemodialysis. I will ask my wife to get vaccinated to prevent passing her the virus. Okay, so they are talking about hepatitis C, and we are looking for the correct understanding. Yes. Okay. Let's see what we can rule out. Can we rule out A? Yes or not?
Yes.
Yes.
Yes, because
Yes,
hepatitis
yes, yes.
C is
You're correct.
acquired as a blood-borne pathogen, no, and fecal oral, okay, disease. So it is ruled out. I'm very concerned because there is no antiviral treatment for hepatitis C. Is this true or false?
It's true.
It's true.
Is false. Nowadays, we have very good and efficient curative treatment for chronic hepatitis C. What we don't have is vaccine, but we have treatment for the patient with hepatitis C that becomes chronic. which is a complication of the hepatitis C that becomes chronic. The patient doesn't clear the virus from the liver. Nowadays, we have something that before didn't exist, effective, proof treatment that can cure clients with hepatitis C. So it's something that you need to incorporate, okay? There is treatment for hepatitis C. Okay, so now we are left with these last two. So because I said there are no vaccine, can you rule out the last one?
Yes.
Yes.
Of course, so must be
Ideally.
option C. Can a person acquire a virus, a blood-borne virus in hemodialysis? Sadly, the answer is C, because those viruses
Yes.
are very
Yes.
contagious, and sometimes there is some type of cross-contamination, something like this, and this is not frequent, but can happen. It's a possibility. So the best option there is that in any dialysis could be a break of the management, and then in some way the virus of one patient can be passed to another patient. So it is true. And then you can also apply the strategy for ruling out. The RN is missing there. The RN is working with an LPN in the post anesthesia unit. Which finding requires immediate intervention. Client recovering of cardiac catheterization present pedal pulses symmetrically decrease. Client recovering of laparoscopy cholecystectomy complains of intense pain in the right shoulder. So it looks like this LPN is not, it's the RN working the post-anesthetic unit, okay? Concerned with what? Client recovering of bronchoscopy for COPD is taking his daily dose of prednisone with sips of water. Client recovering of hysterectomy has bright red hematic stain on abdominal dressing. What is the one that requires immediate intervention?
The COPD one.
B. B.
C as in cat. Are we good? Yeah. Okay. Why?
Because of the gag reflex.
Because in bronchoscopy is applied local anesthesia in the throat, and this can inhibit the gag reflex. And the patient is recovering, still recovering, okay, in the post-anesthesia unit, and should not be taking water or oral medication until it is returned. So it's the one that requires follow-up. You need to go there to see if the patient has gag reflex or not. Having a stain in the dressing immediate surgery is expected. What you do if you have a dressing with an stain and you have this stain and you are concerned, what you do?
Reinforce.
Reinforce. Before that, what you do?
Check.
You
Measure.
You mark
around
the border with a marker. And then you come back in 5, 10, 15 minutes. If you notice that the stain has grown beyond the initial mark, the patient is actively bleeding. And then you reinforce, check vital signs, and call the doctor. But if you notice that the stain has not grown, is the usual, accumulation of blood that occurs, okay, in a surgery, okay? So this is what we do, yeah? We first make an assessment to decide if this is an active bleeding or is the normal blood that could be in a dressing. It is a classical, okay? You mark with a marker the border of the stain and reevaluate after some minutes. If it is growing the size of the stain because the patient is actively bleeding, yes, is actively bleeding. If there is no growing, there is no need of alarm, okay? What you recommend to a patient that is already on the floor, is not impact you, with pain in the shoulder after a laparoscopy, what you recommend the patient to do? Ambulate. This accelerated circulation and the carbon dioxide that is used to inflate the abdomen is going to be absorbed. Okay. Why A is not a concern if the pedal pulses are decreased?
Symmetrical.
Because it's symmetrical. And you know, people that go to cardiac catheterization usually are old, are diabetic, have high cholesterol, etc., risk factor for atherosclerosis, and also they suffer of peripheral arterial disease. That's why they have decreased pulses in the feet, but symmetrically. It's not related with the catheterization. Okay, good, good, good. Okay, we explore all the options. Very good. A nurse instructing a 32-year-old grávida para two on self-breast exams. Which of the following will be the most accurate steps to follow? Start at the clavicle and work down to bra line in a strip formation. The others say start at the sternum and work horizontally to upper outer quadrant. 3. Start the upper outer quadrant in axilla and move horizontally in a strip toward sternum. 4. Start at upper outer quadrant in axilla and move horizontally in a strip through a sternum. This is look like a puzzle. Okay, 3 and 4 is the same. It's repeated.
It's the same, yes.
What is the let me find something more frequently tested about. What is the quadrant in which more frequently is found the breast cancer? Okay, the axillar or the upper sternal quadrant, because you know that is in the axilla there is rarely found cancer. Nodes are frequent, but it's in this quadrant. Okay, is in the upper outer quadrant. It's called upper outer quadrant. This is the like 28%, almost 30% of the cancer are localized there. Around 18% behind the areola. And then in the next the others. So this is the quadrant that is the most important to start. And you can start, okay, in the palpate the axilla, the right upper quadrant, and then you move in this pattern. Okay, in a strip toward the sternum. You understand? In the sternum here, okay, in this quadrant. So the most logical is 3 and 4, which is the same, but it is a bad quality question. Ignore this question. Which of the following patient has the greatest risk for colorectal cancer? 53 years old woman with inflammatory bowel disease, 65 years old man who drinks 2 beers most nights each week, 40 years old obese woman who is frequently constipated, and 50 years old man who was treated for testicular cancer 10 years ago.
One.
What is inflammatory bowel disease? Crohn's of ulcerative colitis, no? Okay. So alcohol age is a risk factor. So this is at risk, this is at risk, this is at risk. It is too young. Too young. It's not the usual. Okay. 45 is when it starts the risk. Okay. So those 3 by the age are at risk. But testicular cancer has no relation nor the treatment of testicular cancer. So we can rule out that. Alcohol is a risk factor, but you need to decide which one is a risk factor. This is not a big alcohol consumption because 2 beers is considered acceptable in males. Is two portions of alcohol include 2 beers per day. And then you have inflammatory bowel disease. When you compare 1 and 2, obviously 1 is the maximum. So the risk of colon cancer in Crohn's disease and ulcerative colitis is extremely increased. It's very, very, very increased. Okay. So you are good for that. So don't forget that. What is the other risk factor for colon cancer?
Family history of colon cancer.
Genetics, okay, family history. And the other risk factor is history of polyps. Polyps, those nipples that can appear inside the intestine, okay, that adenomatous polyps, okay, those are the main risk factors. Say again?
Crohn's disease.
Well, this is the inflammatory bowel disease, Crohn's disease and ulcerative colitis. Crohn's disease and ulcerative colitis is inflammatory bowel disease. Yes, that's why the answer is number 1. A mother brings her 16-year-old daughter into the clinic and tells the nurse that she just found out the teen is pregnant. The mother wants the daughter to have an abortion as soon as possible and states she will sign any consent. Select the appropriate nursing actions that apply. Recognize that the teen may have different wishes for the pregnancy than her mother. Yes or not?
Yes.
Of course.
Yes.
Offer the teen options regarding the available options.
Yes.
Of course.
Yes.
Obtain a consent form so the mother can sign the form. Yes or not?
No,
No.
No.
Why not?
No.
Why
because
not?
She's
Because-
She's
emancipated.
pregnant.
At 16, if she's pregnant, I think she's
You can
emancipated, something like that.
do you know that you can abort without the consent of your parents if you're minor?
yes, professor, but it's optional for the
Okay,
mother.
you are talking about with a lot of security, something that is totally wrong.
No, professor. The thing is, you said in true class before the mother right now the baby have the option to decide under the birth. That's the reason I see it. The mother don't have option for sign any concern because the 60 years old mother have the option on her own baby.
I agree. Es decir, pregnancy doesn't emancipate. Pregnancy doesn't emancipate. Pregnancy confers certain rights, okay? Certain rights, but is not an automatic cause of emancipation. So in all the states where abortion is legal, if it is a minor, the minor cannot go to an abortion without the consent of the parents. Okay, so know that legally a minor in the states where abortion is legal cannot have an abortion without the consent of the parents. This is something in all the states without exception. So
Unless he's married.
unless is married, because marriage emancipates, of course. So if an abortion is going to be done, the mother must sign the consent, because there cannot be abortion without the consent of the parents, and this is the law.
Okay, I understand.
And if Professor Anna, if the teenager wants to keep the baby, Against
this is the conflict that I see is going to need escalate to the court, because they cannot impose an abortion to the minor. The usual is that the minor wants to have the abortion because it's an undesired pregnancy, and needs to communicate to the parents because the parents need to give consent for the abortion. But the problem is that if the minor wants to keep the baby and the parents want to make her abort, then the court will protect the minor and the life of the upcoming baby, no? So this is the stuff. This is an if, but has not been yet. Okay. Um, uh, you cannot be yet, okay, mentioned, had not been yet mentioned here. So the mother, if there is going to an abortion, the mother, okay, okay, um, um, uh, okay, depending of the law, the teen may be emancipated. Can a court emancipate a teen?
Yes.
Can the court emancipate him? Yes. The
yes.
court can emancipate a teen. If a teen demonstrates that can, be independent, the court can emancipate a minor. So the reason for emancipations are basically marriage, go to the army, and going to the army, or being declared emancipated by the court. So can the court, okay, emancipate this? O sea, depending on the law, yes, absolutely yes. Assure the mother remain present to provide emotional support for the daughter. Assure the mother remain present to provide emotional support to the mother. I don't understand that. Okay, I don't see any problem that the mother provides emotional support for the body. I don't see the problem there. Oh my goodness. Do you understand this option?
Be
I
sure
never.
that the mother is there to provide support.
Okay,
Is
ensure
what?
is ensure is a, make a little more sense. Okay, so it is no problem in that, I think. Okay, so the answer key that I have here doesn't include 5, but includes all the others. I don't know what means 5. I don't know why is not included here. Okay, ignore this question. When I have a question that doesn't satisfy my understanding, I move on. A nurse is screening several women at the health center for cervical cancer. Which of the following women is at highest risk? 50-year-old, nulliparous, African American. 40 years old, early menarche is Hispanic. 47-year-old, multiparous, obese smoker. 42 years old, multiparous vegetarian. Okay, who you think is the one that has the highest risk? What is the risk?
Three.
What are the risks? The risk of cervical cancer?
Virus papilloma humano.
Human papilloma virus. And genetics, but it's not very strong. And the other that has been is mentioned by the is smoking. Wait, which one you said?
See?
Okay.
No.
Those are the 3
Early,
sexual activity. Okay. Yes. O sea, promiscuity without protection. Promiscuity. So multiple sexual partners, early age activity, not using barrier methods, but it's not mentioned there. No. So in any moment there, they are mentioning that they don't use They don't use protection. They don't mention they have multiple parts. They don't touch this topic. So what is the only risk factor that we see there? That is a
Smoke.
smoker.
Three.
A smoker.
Three.
So it is the way of dealing with this question. Let me see what they say. Correct answer is 3. Age, multiple pregnancy, obesity, and smoking are all risk factors for cervical cancer. 1 and 2, 3, no pregnancy, eliminate race, ethnicity, and diet are not significant risk factor. Yeah, this is what they say, that obesity and being a smoker is a risk factor. Okay, guys, those are the questions that I had prepared for today. I don't have more questions prepared. We finished early today. Any other question? No?
Oh, thank you,
No.
Professor.
Thank you.
Okay,
so
so
much.
Thank you
Hunger,
so much.
Hunger, see his video of birth in YouTube, and let's
Yes.
investigate what is the best moment to suction the baby.
Thank you,
Okay.
Okay, thank you,
Trust me,
Professor.
This is the
No
way
one
of
knows.
learning, guys. Discussing and finding, evidence-based information. And I
Fantastic review. Thank you very much.
love when you participate. When you participate, like today, without scolding you, I love when you participate.
Thank you,
Okay.
Thank
Professor.
you so
Thank you.
much, Professor.
Okay.
Bye
Thank you,
bye.
Professor.
Bye-bye.
See you next time.
Bye.
Bye.
Okay.
Bye.
Professor,
Yes, ma'am.
I have
No, yes, lady.
a
Sorry, it's a bad
question.
habit that I have, and I don't understand that this is not good to say that to young people, man. Okay, tell me.
Do you know by any chance if the heart block is tested in the Nclex
It's
like
tested
question
very simple. They only test advanced AB block.
AB
Advanced AB block, the 3rd degree. They
third
don't go
degree?
to the 1st degree, the 2nd degree, because it's a cardiologist problem. In
Oh,
1st degree AB block, usually is not treated, it's just observed. And the 2nd degree depends on the case. The doctor, the cardiologist need to decide the patient has indication of pacemaker or not. But the nurse need to care while the cardiologist implant the pacemaker, need to take care of a patient with a symptomatic bradycardia of a total complete AB block at advanced degree. So don't get complicated learning what is a Weckenbach phenomenon, Mobitz 1, Mobitz 2, because it's not worthy. Remember, there's so much information that you need to study. Some of the information are basic. This is the important. So know what to do. For example, question that I remember about AB block. You have a patient with a complete AB block that enters to the ER walking with a bump or a wound in the head. What you do first? Okay, so this is the scenario. A patient has an AB block, they pass out, they have syncope, they fall and have head trauma. Arrive to the ER walking. What is the first that you do if you see a person that have a heart rate 30 and is walking? What you do? The first that you do?
Sentarlo.
Sit the patient. Sit the patient. That's the answer that must have this question. Okay, and this was among the options. Okay, so sit the patient. What you are demonstrated that you are a cardiologist or you are a safe nurse. You demonstrate that you are a safe nurse. You understand? And this is what you need to demonstrate to Nclex. Not that you have a deep knowledge of cardiology or obstetrics or oncology, that you are a safe nurse. You don't need to get 100 in have all the questions correctly answered to pass the Nclex. What you need to demonstrate with a basic question is that you are a safe nurse. You understand? For example, they can ask you, a patient with a bradycardia, like this patient that we discussed today, do you give propranolol? Do you give a beta blocker? No, unless it is your mother-in-law and you know that this bad joke doesn't apply to the Nclex. So this is stuff that I think related with the AB block. For example, they can ask you about the care of the recently implanted pacemaker. Like, for example, not raising the arm beyond the shoulder, avoiding direct trauma in the pacemaker, ¿cómo se llama? Teaching the patient to count the pulse rate and to compare that with the stated minimum heart rate on the pacemaker, this kind of care that you have after the pacemaker implantation. Those are the most important. And the EKG, they put you a bradycardia. You count the big boxes between the QRS, and when there are more than 5, you know there is a bradycardia, and this is the manifestation of the AB block. But this waking back, this MOBITS 1, MOBITS 2 stuff, don't waste your time memorizing that and dedicate more time to study more common dysrhythmia like atrial fibrillation. Atrial fibrillation is tested so frequently. And for example, the steps of the cardiopulmonary resuscitation, to know very well what are the sequence of the steps of cardiopulmonary resuscitation. You don't need to be an expert to pass the Nclex. Just demonstrate that you are a safe nurse. So I don't recommend you to memorize all this amount of variation of AB block.
Okay, Professor. Thank you.
My pleasure.
Okay, bye-bye.
Okay. Let me take the attendance before leave. Let me go to people.